No doubt you remember life as a teenager, back when you took it for granted that you could easily propel your finish across the room, maybe even hit targets with impressive accuracy. Today we're focusing on how to get that power back. How can you switch from a slow sludge back to a slingshot? What's the step-by-step, all-natural approach to increase ejaculation strength? I'm Dr. Emma Blake, urologist and men's health specialist. This channel is all about improving men's sexual health and giving you the strategies you need to perform at your best. Make sure you subscribe and turn on notifications so you won't miss out on this life-changing information. Now, in order to help you make those improvements, first I'm going to cover an anatomy review, because it's really essential for you to understand what has to happen in order for that lock and load and ejection to occur. Then, we'll unlock the mystery as to why this essential fluid even slows down in the first place, what you can do to prevent it from happening, and honestly, you're going to want to watch until the end, because I will cover the all-natural approach to increase the volume of your ejaculation, improve the distance it travels, and of course, give you actionable steps that you can take starting today to begin seeing immediate results. Let's go. Okay, so how does ejaculation actually work in the first place? Ejaculate should be whitish to gray in color, thick and viscous in consistency, and it should have a slight smell, but it shouldn't stink. It shouldn't smell fishy. It should be slightly thick and sticky, more similar to, nasal mucus and less similar to skim milk. Because watery semen, or semen that seems too thick in consistency, can actually be caused by dehydration, not getting enough electrolytes. It can happen if you're ejaculating too much, masturbating too frequently. It's watery because you're literally shooting blanks. Your body hasn't had time to recover. A poor diet, sexually transmitted infections, prostate issues, all of these can lead to very watery or even super thick semen, or no semen at all. So ejaculation occurs in 3 phases. The first phase is the emission phase. Semen enters the urethra through the ejaculatory duct, which is a pathway embedded within the prostate. The bladder neck, where urine is stored, actually closes off so that urine and semen don't mix. This prevents the semen from traveling backwards up into the bladder. Then the semen is pushed further into the urethra, and the next step is expulsion. This is where semen shoots or oozes outside of the body using the force from the bulbocavernosus muscles, the muscles of the pelvic floor, and perhaps most importantly, the elasticity of the prostate. So we're discussing what happens when your ejaculation changes from a volcano to a slow-moving sludge, and what can actually be done about that. Now, before we get into all the steps, I want to mention something that can really accelerate your results. Many of my patients ask me what they can supplement with to support not just ejaculation volume and strength, but also erections, testosterone levels, and prostate health all at the same time. And honestly, there's a prostate supplement I recommend called Prostapeak that addresses all of these areas simultaneously. It contains over 20 ingredients and nutrients specifically designed to support prostate health. Things such as saw palmetto, which helps maintain a healthy urinary tract and supports prostate health. Pygeum, which we'll talk more about in a moment, that helps with prostate urinary discomfort and supports healthy flow. Green tea extract for liver function and prostate support. Cat's claw to boost immune system function. Raspberry for healthy aging and digestion, and soursop to support healthy digestion and boost immunity. Because here's the thing, for many men over 50, an enlarged prostate can impact ejaculation volume and strength significantly, causing symptoms such as weak stream, dribbling, and reduced force. When your prostate is healthy and functioning optimally, everything flows better, literally. Your urination improves, your ejaculation improves. This formulation basically combines over 20 plants and nutrients in a proprietary blend to support all aspects of prostate and male sexual health. I've got it linked in the description below if you want to check it out. But whether you use that or not, the steps I'm about to share will definitely help you see improvements. All right, so let's talk about what's called a structural obstruction. Think of the pathway for your ejaculate as being similar to the on-ramp of a highway. Now, the on-ramp is the ejaculatory duct. Then the ejaculatory duct merges to meet the prostatic urethra. If the prostate is enlarged through BPH, which is benign prostatic hyperplasia, if there's a stone present, or if there's inflammation within the prostate, consider this to be either a partial or complete road closure. It slows everything down, just similar to traffic on a highway. It will also slow the ejaculate down or even stop it in its tracks. In fact, anywhere along the course of the urethra that actually travels through the prostate could slow your ejaculate down if you have an enlarged prostate, or it could even stop it, which means an ejaculation, which is no ejaculation at all. So besides an enlarged prostate causing an issue, the urethra can also have what's called a urethral stricture. It's basically a kink within the tube that the ejaculate is supposed to speed through. If a stricture is present or any other form of obstruction, ejaculate will dribble or ooze instead of actually being propelled similar to a slingshot. Your prostate is supposed to be the elastic band part of the slingshot. The elasticity of it is really what allows you to shoot your finish across the room or wherever you decide to aim. This elasticity is supposed to be present, but as the prostate gradually increases in size as you age, the elasticity is lost. Collagen, which is a thick, fibrous tissue, actually starts to deposit there instead, so that ability to create that slingshot effect is replaced by more of a weak throw instead. In fact, a study looked at over 34,000 men between the ages of 50 and 80 who had enlarged prostates. The study uncovered that 46% of these men, almost 50% of them, had either reduced or absent ejaculate. So because of this, the steps I'm about to share are really critical. Stick with me because coming up, I'm going to give you specific, actionable strategies you can implement today. Let's get into the steps to rehabilitate this slingshot. First, check your medications. Your medication can be something you can speak to your doctor about to potentially get changed. For instance, calcium channel blockers for high blood pressure, such as amlodipine, can have a variety of sexual dysfunctions related to them, and not being able to ejaculate or having slow ejaculate is part of it. Alpha blockers such as doxazosin or tamsulosin, which are commonly prescribed for BPH, can also interfere with ejaculation. Antidepressants, particularly SSRIs such as fluoxetine, SNRIs such as Cymbalta, and certain anticholinergic medications can all lead to ejaculation disruption. So ask your doctor for an alternative medication. That's step 1. Step 2. Increase your water intake. Drink more water and decrease alcohol consumption. Because you see, alcohol actually dehydrates you rapidly. That's why you have a hangover afterwards. This will alter the consistency of your semen, which will interfere with your volume and the distance that it has the potential to travel. Next step, ask yourself, do I get enough zinc? Now, dietary zinc can be found in oysters, pumpkin seeds, cashews, eggs, meat. Zinc is an important part of prostate health. If you want to strengthen your finish, increase your intake of zinc. Zinc supplementation has been found to significantly increase semen volume and semen quality. But just be careful if you decide to take it as a daily supplement. It should be taken with a small amount of copper, or else it can wipe out your body's copper stores and your ability to absorb copper. Now, your body needs copper to make red blood cells, connective tissue, and for immune function. So be really mindful of that. If you're supplementing with zinc, or if you're on a supplement with zinc, make sure there's a little bit of copper in there too, so you don't have to worry about depleting your copper levels. Next step, consider a prostate supplement with Pygeum africanum. Now, Pygeum africanum has been shown clinically to improve urinary symptoms and flow in men with an enlarged prostate. Keep in mind that urine and semen both flow through the same tube-similar structure, the urethra. That's one of the main reasons this ingredient is so valuable. It improves flow, period. Urine flow, ejaculate flow, just flow in general. Next, begin doing what I call pelvic floor exercises to strengthen the pelvic floor. Now listen, the bulbocavernosus muscle is wrapped around similar to a sling around the base of your penis. This muscle sits on top of another intricate network of pelvic floor muscles. These muscles must contract in order to send ejaculate flying. If they're weak or deconditioned, you need to strengthen them. These are a form of Kegel exercises designed to help make your pelvic floor muscles stronger. So here's how I suggest you do them. When you're urinating, try to stop the flow midstream. The muscles you use to do that are your pelvic floor muscles. Practice contracting those muscles when you're not urinating. Hold for 5 seconds, release for 5 seconds. Do this 10 to 15 times, 3 times a day. Over time, you'll build strength in these muscles, which will translate to stronger ejaculation force. Next up, ask your doctor about prostate massage. Now, prostate massage isn't for everyone, but it allows you to massage the pathways where semen has been discharged and traversed. Some of that semen may actually still be trapped there, slowing things down, creating a sludge. Toxins may have built up there over time. Massage can help improve prostate circulation. Blood flow may have been reduced to that area, so it isn't contracting as it should. Massage can potentially stimulate blood flow to the area as well. Now, most doctors aren't going to see the benefit of prostate massage. They'll tell you, it's not really going to do anything. But doctors used to do this in the clinic. Ask them anyway. But here's important. If you have suspected prostate cancer, you should not, under any circumstances, massage your prostate. That's critical. Next, and this might surprise you, stop ejaculating so much. This is last but not least, because here's something I urge you to try. Go through and do steps 1 through 7 for 3 weeks straight. For this final step, I want you to hold off on ejaculating for 2 weeks straight. Still have sex, still play around, still do what you do, but hold back. And on that 14th day, let it rip. I want you to come back here and comment about the results that follow, because I think you're going to be really surprised at the volume and force. Your body needs time to build up reserves. When you're ejaculating every day or multiple times a day, you're not giving your system time to produce quality, voluminous semen. Give it time to recover, and you'll see dramatic improvements. So to recap, check your medications. Increase water intake and decrease alcohol. Get enough zinc. Consider a prostate supplement with Pygeum africanum, or that Prostapeak supplement I mentioned, with saw palmetto, green tea, Pygeum, and over 20 other supportive ingredients. Strengthen your pelvic floor muscles. Ask your doctor about prostate massage, and give your body time to recover between ejaculations. If you implement these steps consistently, you're very likely to notice significant improvements in ejaculation volume, force, and distance. Subscribe so you don't miss out on this groundbreaking information about men's sexual health. Give this video a thumbs up if you found it helpful, and share it with someone who might benefit. I'm Dr. Emma Blake. Take care of yourselves, and I'll see you in the next video.